Okay, so now we are going to look at the actual structure of a policy brief. I'm going to make this presentation, but after lunch, we are going to now look at the actual template that we are going to use this afternoon. So, next slide. So what is a policy brief? Ideally, it's a concise summary of a particular issue or policy options and recommendations. It should be aimed to policymakers, to stakeholders, and even the public. So today we mentioned a lot about the policymakers, but policy briefs can also be addressed to a whole different range of stakeholders. It should be evidence-based. We've talked this a lot. It should be accessible, and more importantly, it should be action-oriented. Next slide. So what are the characteristics of a good policy brief? It should be clear and concise. Even the 8 pages is very long. So 2 pages is the most recommended length of a policy brief. Sorry. It should be, like we mentioned, evidence-based. It should be neutral. It should be structured for easy scanning. So if you give somebody the policy brief and they're in a hurry, they can't be able to just capture the information very fast and know what to do. And it should be very practical and have actionable recommendations. So this is the standard structure of a policy brief as recommended by WHO and very many other organizations. We should have a title, and a very clear, concise title, which it should have justification and purpose. There should be a key policy message or key policy messages. What is the take-home message? What is the action that you'd love your audience to work with? So there are different policy options, and you need to show what are the advantages and disadvantages of the policy options that you are proposing. There has to be a methodology, not only on how you received this information or how it should be actionable. There should be implementation considerations, financial, relational, and all different other considerations. It's good to acknowledge and also to mention conflict of interest, and where possible, it's very important to also mention the references. So this is a very standard and structured structure of a policy brief. So we can look at the tables for policy options. So there are very many different policy options that we want to really address. So we are comparing these options based on the effectiveness of these options, the cost of these policy options that you're proposing, the feasibility of actually conducting or actualizing these policy options, the equity component, which is quite important, and stakeholder support. So do you have a buy-in from all the people that you would want to come into and actually actualize this policy? So what we've also mentioned, I think all the speakers before me have mentioned that it's very important to use effective visuals. And this afternoon we have an entire hour on how to use effective visuals on this policy. So using of charts, infographics to just simplify the data to ensure clarity and avoid clutter, and include captions and sources of all visuals. So if they're not coming from you, you have to acknowledge where they come from. So this would be a checklist, and a very simple one, clear and purpose and the audience. So who are you addressing it to? Concise key messages, balanced analysis for options that you are proposing, practical evidence-based recommendations, and proper formatting and references. So we are going to have 2 presenters now who are going to show us the data from both of them are from DASH. So first we will have Irene talking about the mental health work that was already been done during Wave 1. And then afterwards, we'll have Samuel, who has done a cross-domain of the policy options and policy mapping on all the domains of interest. Thank you so much.
Sorry. Do I just say next slide?
Yes, sir.
Okay.